Hello and good
Hello,
morning.
Hello,
or
everyone.
evening, or afternoon, whatever suits you, wherever you are. Please say hi to us in the chat so that we know we are live and being listened to. Today, we have a very special guest, one of our earliest listeners, I would say, somebody who you've seen in the comments, somebody who's been saying hi a lot of this time. And today, she's here to share her story. Reena,
Yay,
would
hi
you
Reena.
Hi, Dieter. Hi, Darko. Hi, everyone. They've already introduced me, but I'm Reena, and I'm an English language teacher based in San Sebastian, which is a beautiful, beautiful city that I highly recommend you visit if you have the opportunity on the north coast of Spain. However, I'm originally from the north of England in a lovely but slightly chilly region called Yorkshire. And I used to be a community pharmacist. so I've been teaching in San Sebastian, or Donosti, as it's called in Euskara, which is the local language here, for over six years. But now I've decided to take the leap into teaching medical English, so bringing together my background in pharmacy and my teaching experience to help my students.
Lovely. Um, what brought you to inclusivity in medical English? How did you get there?
Oh gosh, it's a long story, to be honest. I suppose it's something that's always been there throughout my life experience as a British national. Although I was born in the UK and I was brought up there, but I'm a daughter of immigrants. My my parents were both born in India. My mum moved to the UK when she was 3 years old, and she's bilingual. Um, my language skills in Gujarati are unfortunately not as good as I'd like them to be, but I can understand more or less. So I was brought up with both cultures really. So my cultural references include like celebrations we have, such as Diwali, and I'm from the north of England, so Yorkshire. The Yorkshire region has its own traditions as well. So that's part of my identity. I don't feel that we have one identity per se. There are many different factors that influence and shape our lives. And I suppose when you're in the pharmacy as well, some of the patients that come in to see you are often very vulnerable. I had a lot of patients with who struggle with their mental health, or they may be recent immigrants who don't know the language particularly well, but they still need help and to be treated with dignity. Or you may have patients who have disabilities, so we need to listen to them and find out, how we can help them best and use inclusive language so that they feel respected and treated with dignity. And I suppose as well, this carried over to when I first moved to the UK. So when they were expecting someone, well, my students were first expecting somebody English, it just came as a shock when they saw me because it didn't sort of tie up with what they saw in the textbooks or what their interpretation of what a British person looks like, when there's no one way to be British, when there's been diversity for many years. I mean, we even had a black Roman emperor, Septimus Severus, like many, many centuries ago. So we've always been shaped by migration.
Well, you're saying that people are saying hi, so we are live, Reena.
Okay, so hi, Ekaterina and
People are coming
Dimitar,
and saying hi.
if
Great.
I've pronounced it correctly. I hope
Dimitar and Ekaterina are here with us. Thank you so much for joining us. If you have some questions for Reena, please send them in.
Did you see that people had some? Did they question you being as an English person, British person, or have some really bad assumptions because you didn't look like you were supposed to be there? How they thought an English person should look like?
like, I mean, like the vast majority of people, I think when I think because I sound as though I'm English, usually accept that. But unfortunately, there are always going to be a minority who still question that, where they'll ask where I'm from. I tell them the answer, and then it still isn't believed because I suppose, like some people, feel the need to put people into these binary boxes when I think, it doesn't always work like that. I mean, how do we place people who have more than one culture? For example, bilingual people, where maybe one parent is from one country, another parent is from another country, and then they live in a third country, so they're like third culture kids. Like how do we put them in a box? Okay, we're not allowing for nuance. I mean, at first it did irritate me somewhat, but I try to educate, and if people accept it, they accept it. If they don't, they don't. I think they just have to come to their own realization about it. But there was an incident in a bakery where I asked a man if he was in the queue in Spanish, and I was just expecting, like, yes, I am. No, I'm not. And instead, I got a whole interrogation about, where I was from. So I told him where I was from, even though it wasn't relevant. And then he told me, oh, but you're not really from there.
Okay. So you
Okay.
can't buy bread
Yeah, so I
before
can't buy
giving
bread.
your full
Yeah,
background.
I just wanted to know, are you in the queue or not? Because I don't want to push in.
Okay.
Oh,
I didn't want to tell a stranger my commentary about, where I'm
did you
from
ask
and
him where
where they're
he is from,
from.
perhaps?
I could have done, but I think I was just slightly taken aback more than anything. I was just expecting a yes or no.
As one would in this context.
And then
Vishnya
also,
is here with us as well. Good morning, Vishnya.
and
Oh,
also,
people are weird.
why ask if you're just not going to agree with my answer?
Yeah.
That's why, probably,
Yeah.
for a desire to have some conflict in this
Okay, we've
space.
got my former course mate Tanya here. She was corrected in the pronunciation of her daughter's name.
Oh my
My
goodness.
goodness.
That's high level. How would you know, Tanya?
Yeah. Oh, and there's Mary as well. Hi,
Hi, Mary.
Mary.
Good morning. Have you had such experiences as a patient, maybe as an immigrant to Spain? And have you observed maybe some interactions in the UK when you were in healthcare that got you thinking, okay, maybe some training in communication would be helpful here?
Oh, yeah, definitely. Because I suppose, like, even when I was doing my course, I don't recall ever being, taught specifically how to communicate with patients. And I suppose it's a lot more crucial if you're working in a hospital where the patients are a lot more ill, or maybe find it more difficult to communicate. But it was something we just tended to pick up during our pre-registration placements, where we were shadowing other professionals and observing how they communicated and tried to take that on board. But I think it's all very well observing how somebody else communicates and then being able to do it by yourself instinctively, and then also trying to teach somebody else how to do it. Because often these situations come unannounced. And often these patients as well, they're quite distressed. They're in a lot of pain, or maybe they've had to wait a long time in the GP surgery beforehand. So, yeah, they're not always in the best state of mind. So, as health professionals, we need to put them at ease and feel more confident about opening up and describing how they feel. So I guess like one typical issue is that, particularly with patients that come in, and this can happen anywhere, that they're recent immigrants, or they're not overly familiar with the language and they're trying to express what's happening, but they might need a little bit more time to describe their symptoms, or perhaps they're a little bit nervous, and again, they might just need a little bit of probing and some reassurance from the doctor that they're here to listen, that there's no judgment, so that they feel safe to open up. Because otherwise, as health professionals, we're not getting the full story, and there's a danger that they're going to receive a misdiagnosis if we haven't got the full picture. So I suppose patience is important. And then also checking that we understand what they're trying to say as well, because the patient might be expressing something, but they mean something else. So I think it's, important that we clarify. So something along the lines of, okay, so just to check I've understood correctly, you said this, and this. Is that right?
Yeah. So it's not only a problem with a problem, let's say, with immigrants. It could happen also with tourists. We in Croatia have much more
Many more tourists as
situation with
well.
tourists. So yeah, they do not speak local language and they have problems. Would you say it could, some translation help would be able to be done via some AI or Google Translate? Would this help?
I've never tried it personally, to be honest. Well, actually, Google Translate first, when I first moved to Spain, and I was trying to, explain in detail to the doctor what symptoms I have, because I didn't have the language for it. I mean, I could make some gestures to provide some clues, but I guess it could help to a certain degree. But as we know, Google Translate can make some errors. There are also false friends that we need to consider, like constipation, constipado, are two very different things. Then there's being embarrassed, and then embarazada, which means pregnant in Spanish, not embarrassed. So there are some words that are very similar, what we call false friends. I mean, do you have them in Croatian as well?
Yeah. So this is what I mean. It's perhaps advisable not to use such tools, even if a person might try to communicate via it. So it could be more harm than help.
Yes, I mean, I agree. I mean, I think it's useful to a point, but
Something to double check.
also that we have to double check, and as health professionals, like clarify that we've understood correctly. So there's two parts to the conversation. It's the patient that's trying to convey what they're feeling and what's wrong, and then us as the health practitioner making sure it's clear that we've understood correctly before we start giving advice or treatment.
You have a very reassuring aura, and you have an approach where I can tell. I think people get relaxed fairly quickly, and you have this kind of, gentleness to yourself. But I think a lot of people in the comments, and probably you yourself, have met some practitioners that are maybe a bit more direct or very practical in their approach. So they might think, oh, this is a waste of time. Come on, just list the symptoms to me. I have people waiting. I don't have time for your emotions. And let's say their boss sends them to have some training with you. How do you normally deal with such people, or maybe your former colleagues, that are very result oriented and demonstrate that that's not the whole story?
Well, I suppose I'm doing Ros Wright's course about communication skills in healthcare, because obviously I'm familiar from a practitioner point of view in a very specific niche, which is that community pharmacy. But I understand the consequences are a lot more serious in a hospital setting. So I just found, okay, it's handy for me to have a greater awareness of the skill set in other settings as well. Well, one of the issues of looking at communication purely from seeing patients as a list of symptoms is okay, it might get the job done, but the patient might not reveal everything that's wrong with them. There's more than just the symptoms. How they feel, or maybe a history of what has happened in the past, might suggest a different history. And also, if you treat people as a list of symptoms rather than a person, that might make them less reluctant to return. And then should they end up, with a serious condition, they may not seek the help that they need. So I think, that's why we need to have a more holistic approach and centre the patient to get a full picture of what they're feeling and what they're experiencing, because some things only become evident after finding out their patient history.
That's a great point. So if you are results oriented, you have to be aware that you might not get the best results with this kind
Exactly,
of
you
bare
might
bones
not get
approach.
the best results because we're dealing with humans, not a list of symptoms.
Absolutely.
Okay, and then it can sorry, jumbling my words. It's like very early in the morning. There's a danger that the patients can be misdiagnosed, and that can cause more harm than anything. So, I mean, I can give an example. So I was here in Spain, and I had to see an emergency doctor, and it turned out I had shingles. The rash on my face matched up. It was painful. It was on one side. He asked about my medical history. So I had chicken pox in the past, and it's likely with people who have had chicken pox as a child for that to flare up later in life and develop shingles. But when I saw my GP, she was very insistent that I had eczema on my face, even though I had no history of eczema at all. But she was unwilling to listen to me, even though another doctor had confirmed and taken a detailed history and determined that it was shingles. And she prescribed some hydrocortisone cream for my face, but it was 1% hydrocortisone cream, and like typically in the UK, we would recommend this for maybe like insect bites on your hand or your arm, and we would recommend a weaker preparation for the face. Of course, yeah, I didn't apply it. I just wanted something to help with the residual itching. So by this point, you know, the rash had lessened, but it was incredibly itchy and uncomfortable. So that was a case where it was a little bit frustrating, where I didn't feel listened to. It was as if she decided, okay, this is what you have. This is logical to me.
And you probably didn't return there.
No, because I ended up moving house anyway. So now I have a different doctors, and my last doctor, the last doctor that I saw was absolutely wonderful. So despite the language difference, she took the time to listen to everything that I was saying. She was warm. She introduced herself. She said who she was, because that's another thing as well. I've got a message from Tanya. Did you ever take her up on it? Sorry, could you expand on that, Tanya?
Did you
sue her? Very simple. Oh, she prescribed me something wrong.
Yeah. I mean, I did tell her, but she just didn't appear to be listening. So I just didn't cash in the prescription. And I bought some calamine lotion, like over the counter, just to help relieve the itching. And I found some antihistamine somewhere.
But you were a well-informed patient.
But it's only because I was well-informed. But another tourist may not be, or they may not have a medical background, and they're trusting. I mean, did you tell her? Yes, I did tell her. I mean, she was still pretty insistent that it was eczema, despite the fact, another doctor had clearly said it was shingles, although fairly young to have shingles, but based on the presentation and my symptoms and my history, it was shingles. Yeah.
It's quite important to be able to advocate for yourself in these situations.
Definitely as well. But I think this is something that even transcends language, because even if you're having conversations with healthcare in your own language, it's like you said earlier, sometimes they have a short time frame, and depending on the personality, they could be more focused on results and symptoms. And in fact, they're probably very good at their job, but maybe they don't feel so comfortable with people skills.
But it could be completely dangerous, because you might be allergic to something and they prescribe you that.
Yeah. I mean, they should ask, whether you have any allergies.
Did she?
Did she ask? No, from what I remember, no.
So it depends on person to person.
Directed. But then I've had other consultations where, they've allowed me space to express what's happening and maybe give me time to look up words and use facial gestures just to make it clear what I mean. So it
they
really
were
depends.
Human first and patient
human first and practitioner second. Okay. So Tanya's got an interesting experience that she wants to share.
Would you like to read it, Reena?
Okay, yeah. So what happened was that when I made an appointment, the receptionist asked me what it was for, and I tried to explain in German. So German isn't Tanya's first language, but she lives in Germany. And then she came to the wrong conclusion, and she told the doctor this. So the doctor started out with a partial diagnosis already made by the receptionist based on my attempt at a short description, which is worrying, because receptionists are receptionists. they're not clinicians, so they're there to help the doctor and organise the appointments, but they're not there to diagnose. So that's incredibly worrying. It'd be interesting to know, Tanya, what happened next. Did you end up with the correct diagnosis eventually?
I don't know if her previous comment is connected to this story, but she said that she gave feedback recently when she was pigeonholed, and the practice responded to this and actually did train their staff. So let us know, Tanya, if this is connected. Yeah, okay.
It was connected.
She's confirming this. Yes. Okay, so we have a positive story in the end.
Yeah.
Yeah, but she needed to understand what the doctor was saying in the background. So if you're a complete foreigner and do not know the language, that's the problem.
Mm-hmm. For sure.
So sometimes I think it's not even, the language itself. I think it's just poor communication skills. I mean, there have been cases even in the UK where I guess when receptionists receive a lot of requests for appointments, and then they're trying to screen them and decide which ones should be priority, they start asking questions about symptoms, but then they're making a call about which patients require an appointment more urgently than others, when they're not really clinicians. And then perhaps patients are also unwilling to share like the nitty-gritty of what they're feeling with someone who isn't their doctor. So perhaps they're not seen as urgently as they should because they've withheld some information. Or perhaps it's been misunderstood, as in Tanya's case.
What should healthcare professionals do in situations when they do make a mistake? Because they will. Everyone.
They will mistake.
does.
We're all human. We all make mistakes. Whether you're a teacher, you're a doctor, a builder. Yeah, we all make mistakes, but we have to own them rather than let it continue. So if you've made a mistake, own up to it and make amends. Look, I'm sorry. I got this wrong, but I want to make it right. Could you tell me what I could do to help you? And I suppose it's like learning not to be defensive, and I suppose it applies to a wide spectrum of different cases. Having that humility to admit when you're wrong, because we all will be at some point. Nobody's perfect, and that's okay. But what we should do is, I feel, so this is my opinion only, that we should strive to be better. And I think it builds us as well. I think if we show that we as well aren't perfect, we make mistakes, that can also help, our students and other people to connect with us better, because we're showing our humanity and our empathy, which I think, given recent events, is sorely lacking.
Are there any recommendations, would you say, to the medical staff how to handle when they have people like Tanya say who are not for whom that is not their native language, and they are not overly confident to even speak up, just to maybe not to get to the mistake, because with builders and with other people, mistakes are costly, but not as much costly as when doctor makes them, because they can be life and death situations.
Exactly. I think the first thing is like maybe create an environment where patients feel relaxed and feel comfortable to open up and share what's on their mind. And it can be just something as simple as like starting off the consultation by saying your name, who you are, what you do, and asking
Not where you're from, and not you're not from there, like in bakery.
yeah.
Question them.
No. Oh my god, that was another customer. But no, just like something on the lines like, so when I was working in the pharmacy, and maybe some, there were lots of different staff in the pharmacy. So we had the healthcare assistants that were like manning the front and then screening the patients, because there were some maybe consultations that they could handle themselves, and they were given a set list of questions. It's called the 2-1 questions to ask to screen how serious the complaint was and whether they needed any help from me. So this in turn saved my time, but also allowed them to help the patient within like their remit and within their ability. But again, it's like putting the customer at ease, or the patient at ease when they come in. They would say hello, maybe have a slight chit chat about the weather, like, oh, because I don't know, us Brits, we love to talk about the weather. Oh yeah, bit warm outside, isn't it? How are you doing, Mr. Morrow? So, because we get our regular customers as well, so it's like makes them feel comfortable. What can we do for you today? So that helps them open up the conversation. And the 2-1. So this is something that the healthcare staff use like as a guide. So the first W is who. We need to ascertain who the patient is. Sometimes when customers come in, they're not asking for themselves. Maybe they're asking for, I don't know, some medicine for their elderly mother or their child. Okay, so who is it for? So if it's for a child, or maybe somebody who's elderly who might have other like comorbidities and they're taking other medication as well, it might be a good idea to refer them to a pharmacist. What are the symptoms? Okay, so we ask the patient to describe what symptoms there are. H, how long have they had these symptoms for? So for example, if you've had diarrhea for maybe less than 24 hours, they haven't been abroad, there's nothing unusual that they might have eaten something unusual, but it's fairly straightforward. You could treat it. If, however, they've had diarrhea for over a week, perhaps they've been abroad, it sounds like it could be food poisoning, maybe they're vomiting as well, then that would definitely require a referral. Because they're likely to become incredibly dehydrated, and it could indicate another like serious condition. So that's how long they've had it. Action. So action they've already taken. So have they tried anything else, and like how successful was it? And then M is medication. So are they taking any of the prescribed medication or regular medication? Because that might influence what we'd recommend in case there are any drug interactions that would make the first choice unsafe to take.
Great. So when you would recommend someone to train their staff, you would actually create a checklist or if then
Definitely. And then the
questions.
2-1 is easy for them to remember, and it serves as a guide as to what they can deal with themselves confidently, and when they need to refer, when it's out of their remit.
So Tanya is repeating it
Who?
for us.
Who is it for? Because they can come in and they can just tell you everything, and then you think it's for them, and they're not. They're asking for their
Yeah, but you look
neighbor.
okay. What is wrong with you?
Yes.
They describe the symptoms, but you don't see it.
Yes. And then also not all symptoms are visible.
That's a great point.
They need to describe them.
You might need some very complex language for that. So it's again an area where if you're not confident in a language, it can be quite difficult.
It is,
So
yeah.
they might need
And I suppose
extra
it's also
questions.
recognizing. Sorry, I'm interrupting. Yeah, yeah. I suppose it's also recognizing as well that if English or another language isn't their first language, just being patient, because maybe that customer or patient might need a little bit more time to express what they're feeling or describe those symptoms.
Yeah, so to work also on some basic communication skills.
Yes, and you might need to probe as well. So, and even the language that we use as well. So I suppose, many health professionals, we use medical jargon because that's how we're taught. But patients don't in many cases don't understand those terms, so we have to break it down for them.
That's
So,
not easy. That's
which isn't
basically being an
easy
educator as well, in a way.
as well.
Would you say there are also problems with some cultural differences? Perhaps, I don't know, a doctor might not be allowed to touch someone in their culture, or let's say it's normal in our Western society when you come to a doctor, okay, undress yourself, and that is not in other person's culture even acceptable.
Ah, yes. That's another issue as well. But I mean, certainly in the UK, from what I last remember, you can ask for, a chaperone, say from the same gender or somebody you're comfortable with, in these situations. So I remember when I was last working in a pharmacy, like we have a consultation room. Where if, for example, a patient wants to talk privately, away from the other customers, perhaps they're a little bit embarrassed, and so not to be in the room alone with, say, myself or another pharmacist, they can ask for, a chaperone to sit with them. So it could be somebody they've come into the pharmacist with, or maybe another member of staff. To sit in the consultation with them, and that's their right.
Be informed about your rights and
Exactly.
inform the patients about them as well.
About them as well. So, like, even asking them, okay, would you like, a chaperone to come with you? And explaining what you're doing as well. So, I suppose, in some cultures, it might be uncomfortable, to ask them to, okay, just undress over here and lie on this bed, if they aren't given any warning. So I suppose, like, explaining what you're doing and why helps put them at ease, so then they realise, okay, why I'm being asked to do this.
That's a big one. From my experience, I don't remember getting a lot of whys for a lot of things. So perhaps asking that confidently is also something to think about as a patient.
Yes.
What is this for?
So, like, what is this for? Why are you doing this? And I think Tanya mentions as well about being confident, which I suppose it can be difficult if you're not communicating in your first language, or even if you are communicating in your language, if you find the medical staff quite intimidating and difficult to open up to, that can be another challenge as well. So another thing that's come up, I've heard from various messages, maybe not here, is about some patients don't feel they're being taken seriously about their pain or their symptoms, and it's being able to, I don't know, like, be confident, assertive, and physically state this is like severely, impacting my day-to-day life. I'm struggling to sleep. It makes me feel anxious. So like describing the impact it's having on you, because I think sometimes when we just present symptoms, we're listing the symptoms, but we're not really describing the mental impact this has on us as well. And I think it's very easy to just focus on the physical symptoms and not on the impact it has on our mental health as well.
Would you
And
say it
also,
helps to write it down?
I do, yeah. I did that initially when I first moved to Spain, especially if I wanted to talk about something complex, that I know that I'd find it incredibly difficult to be able to do that off the top of my head. So yeah, I would write it down, because sometimes in the spur of the moment you suddenly feel nervous or anxious, and then you forget to mention something, and then you realise after you've left the room that, oh, I should have mentioned this.
Would you say that educating patients might also be a part of the process? I mean, like having a written procedure or how they should describe their symptoms and everything else, and how the procedures look like in their own language, at least translated not by Google Translate, but some real
I
translator
think that
in
would
a couple of
definitely.
languages. Yeah.
I think that would. I think that would definitely
Did you
have.
see that being used?
I haven't seen it used in Spain, but certainly in the UK. So there are patient resources such as NHS Direct, where there's information about conditions and what's expected in different languages. I'm not sure if it's on the website, but certainly when I was working in the pharmacy, we had leaflets in different languages. And I know for a fact there were some like in Urdu, in Polish. I'm trying to think at what else. I think maybe in Czech as well. But yeah, in several different languages, and it was mainly based on like the local population as well. So that at least they have something accessible in a language that they can understand and they can read before they go into a consultation.
It sounds very useful.
Yeah.
Tanya has had quite a few comments in the meantime about how explaining what you're doing is super important, and good dentists always do that for anyone. I would say that would
Yeah,
be
but
one of
there's
my
a
first.
problem when there is a language barrier. So
Yeah,
yeah.
yeah, for sure. One of my first positive experiences in healthcare was definitely realizing, oh, I could actually get explanations for all of the steps. So that's something that's overlooked. But yeah, a language barrier can be an issue.
That
She's
might be a problem with the dentist when you have your mouth open and cannot speak.
Speak,
Why do you
yes.
do that? Do you need to go with that drill there?
But that even happens in your own language. Well, I had a really lovely doctor, not doctor, dentist, but he was incredibly chatty, and like my mouth would be wide open, and then he'd be just firing lots of questions at
Will
me.
you stop talking, please?
My mouth's open and I can't speak.
Okay, we have the other example as well.
But he definitely put me at ease. Yeah.
Okay. Tanya has shared the story as well. A Chinese friend gave birth here, and in the throes of her labor, she could not speak in German, so her husband translated for her. And when she asked for anesthetic, he decided she didn't need it. So he didn't ask for it. This makes me so angry on so many levels. The staff were listening to him, not her, because he could speak German.
Yeah, I guess they had a talk afterwards.
Yeah, this is a serious issue.
On so many different levels. There's an element in bias here that the husband is more worthy of being listened to rather than the one experiencing the pain and needing the medical help. The other
Yeah,
thing as
but they
well,
couldn't
like
have
she
understood
wanted,
her, so perhaps they asked if she needs some anesthetic, and she said yes, but he said no. She said no. Well,
he said no, but then he's decided that she doesn't need anesthetic, but she's the one that's experiencing the pain.
yeah, but I guess they couldn't understand her, so that was a problem.
Okay.
And he couldn't understand her.
But
That's
he
a
could
deeper
understand
problem.
her.
Yeah,
Oof,
so he's the problem here, unfortunately.
unfortunately, yeah. But then I'm thinking, like, how you, I don't know, there are ways to express pain without language.
Yeah, for
Yeah,
sure.
unbelievable. Yeah, he decided. I mean, like, she's screaming in pain and clutching her husband's hand, like, give me anesthetic. Yeah.
Well,
This
he
is
might
a
have been in a pain later.
Oh, yes, I can imagine. Yeah.
quite likely. Um, how do you deal with these kind of situations when you have a conflict where we don't know the context? Obviously, maybe the healthcare professionals decided that it was something that they had a mutual understanding on, and they didn't want to go against her wishes, thinking that he's voicing those. But you have a patient that is in a completely different state of mind with completely different wants and needs. Um, it's not an easy situation from the healthcare professional point of view. How do you probe, especially when it's such a difficult moment? You know, a person is in pain, there is an emergency of a kind, there's something very intense happening. How should one act in such a situation?
Okay, so I've never actually been in this situation because usually when I've dealt with patients, they've already been to the hospital, they're on some maintenance treatment, or it may be a patient that's come in and they need something for diarrhea or a cold, and they're already on maybe some maintenance medication, say for their asthma. But in this kind of situation, I mean, it really is, it's a tricky one, isn't it? But I believe, yeah, as someone who's been in the health profession, that we should focus on the patient first, unless they've given their consent, um, to delegate that responsibility to someone else, maybe if they don't have the capacity to do so. Perhaps if they have maybe some learning disabilities or some severe like mental health issues where that responsibility has to be delegated to to somebody else. I think the focus should always be on the patient because they are the ones that are experiencing the pain. I don't know, there might be many different approaches to that, but if I do feel that a patient's, I don't know, partner or family member who's accompanying them is taking over and not letting the patient speak, I might just like assertively tell them, okay, can I just listen to what so and so, Claire Harriet, wants to say, please?
Mm. So when we talked about chaperones, it can be a double-edged
It
sword.
can be a double-edged sword.
Okay. Tanya is further giving details. I think it must have been pretty clear that she wasn't happy that they eventually sent her Chinese mother out of the room because she was so stressed watching her child suffer and nobody listened to her. So it sounds like a pretty bad situation where everyone has their own perception of events, but seems that no one was happy in the end. So this is kind of the worst outcome.
And I just can't possibly imagine like how much stress Tanya's friend must have been under, and the effect that might have had on the baby as well.
Yeah, for
Because I
sure.
guess like giving birth is stressful enough as it is, especially if it's your first child. And then not being able to fully understand what's happening, being in pain, and then being deprived of the anaesthetic which you want, and then also somebody else deciding what's best for you. Oof,
Yeah.
so many different
Layers of issues
issues
there.
to look at.
Tanya is saying perhaps that should come up in training of staff. I haven't had a child in Germany, but in the UK, I had a birth plan that the midwives were informed about, and we went through different scenarios and what our decisions would be.
Exactly.
So that's our answer, right? Set up the expectations before
Set up
and
the
ask the relevant
expectations.
questions.
Yeah, definitely. So then patients know what to expect. And I think it reduces the anxiety if
For
they
sure.
know what's going to happen or what's supposed to happen. And it also acts as a useful guide for the health professionals as well, if they know what the patients are going to expect. And it also gives them some structure in their care plan too.
Mm. And a cultural background, because medication is also one of those things where people might disagree for various reasons, thinking of natural childbirth as there can't be any medication and being very strong on that, and then you feel
Oh,
pain suddenly, right?
definitely.
So
There's cultural beliefs as well. I remember having an interesting conversation with another teacher about how they went to France, and she requested something for her child, and they prescribed a suppository. So I hear that in France, suppositories are more commonly recommended than, say, tablets or syrups in the
mhm,
UK. So I suppose that came as a little bit of a shock.
for sure. I
Yeah.
didn't know that. It's good to know if I find
Oh,
myself in a French
yes, you
hospital.
might be presented by with a suppository. I suppose there are advantages to that. Less side effects usually than taking something orally. Um, okay. Ah, that's interesting as well. Like maybe having an agreement ahead of time for a code word.
What do you think about that? Is that common practice?
It's not something that I'm aware of. I wonder whether Tanya means, like for example, if you come with a chaperone, that you have some sort of code word.
I suppose. Darko, would you please read the comment?
Oh, it's my turn. So it's the longest comment today. Okay. So Tanya said, I have asked doctors if I can record our session. Okay. So it's also connected to myself. So video the whole session so that I can afterwards unpack it, because sometimes you think you understand everything and you afterwards you think, what did she say again? I think this would help anyone actually, because the same thing can happen even if you speak the same language, because you're dealing with medical terms that may not be known even to a native speaker. I'm not sure it's really allowed to record something like medical procedures. Do you know, Reena?
Oh God, I don't know. I mean, I've never been asked, but it's not something that we would do because there are data protection issues.
Mm.
Yeah. So
Yeah.
also doctors might get sued because something on the recording. So I don't know.
No. But I mean, yeah, I get her point because sometimes you think you understand everything, and then you think, okay, what did you say? I mean, that's happened to me. Like when you're not feeling well, and then
Yeah,
also when
but it's always good to just ask again the doctor. Okay,
yeah,
what
I
did you
think it's
say?
just
Can you
good to
explain it once
again.
more?
Like another strategy I've used, like in the pharmacy when we're explaining how to take medication. Like, it's very easy for people to, to ask, oh, did you understand? People say yes to anything, maybe because they're scared of looking stupid if they ask again, even if they don't understand. So another way around it is, okay, just to check that I've explained it correctly, can you just tell me how you're going to take this medication? So then you're asking them to repeat back to you to check that they've
Okay.
understood.
So
It's
to
a
get
teacher
back to
method.
to get to that
Yeah.
recommendation, you were saying a minute ago something about something different than syrup or tablet, and I don't understand that word. What was that about?
Suppository. So a
Yeah.
suppository is a type of medication that it melts and you put it up your bottom.
Oh.
Oh.
Okay. I thought it was this, but
Yeah, so
I
that's
didn't know the
called
name in English.
suppository.
Okay, so suppository. Okay.
Okay.
That's a new
It
one for our
melts
live
in your
show.
bottom. Okay.
We've
Yeah.
come
So
to
you
bottoms.
insert it up your bottom and then it just melts.
Yeah. Okay.
Tanya is clarifying that doctors, in her case, agreed to it. She did have their permission, but not everyone would feel comfortable with it. I honestly don't know the rules and regulations around this in public healthcare in Croatia, for example. This has never occurred to me as an option, but I suppose you can ask for everything in writing. That is your right, and that is something that doctors are
Yes, you can
supposed to
ask
do.
for everything in writing. And
Yeah, and you'll
certainly
get it in Latin.
for your pharmacy medical records, you can apply in writing and request a full copy of your medical records. And I can't remember off the top of my head, but I think they can take up to a month. But yeah, you can request it.
Yeah, so it's your personal information.
Because it's
So
your
by
personal,
GDPR, you have
but
to have
you have
it.
to submit a written request.
If there was one thing that you know that healthcare professionals are bad at and they really need extra training on, one communication skill or something that is in dire need of change, what would you single out?
Ooh, that's a tricky one
So
because
many of bad habits.
I've had both positive and negative, experiences. I suppose, yeah, maybe some doctors could do with having a better bedside manner. I mean, had one back in the UK, so this wasn't a communication issue per se. I understood what he said. But I'm a runner, so every so often I end up with some sort of injury. So I went to see a doctor, and he was just very, very abrupt. And he got me to lie on the bed. He prodded my calf, which was sore, so I pulled a muscle, and said "ow." But yeah, he just wasn't particularly gentle, and it was a little bit grumpy as well. I mean, he gave me the medication I needed. That was fine, but I did leave the room feeling, oh God, I hope I don't meet him again. Because he was just so, just so blunt. He had no bedside manner whatsoever. But then I was in another situation where I'd had a sore throat for over 3 weeks. I'd already been to see the doctor. And then I had to see him, and then lo and behold, it's him again. And I thought, oh no, please. But actually, he was brilliant, but he just doesn't have the patient skills. So he asked, what's wrong, and then he explained that how I'd had this sore throat for like over a month. I'd already been to see the doctor. I've already been taking anti-inflammatories, and I was losing my voice. And at this point, my throat had started swelling up. And then he just said, "Why didn't you come in earlier?" It was just like, no,
Are you listening to me at
empathy
all?
there. And I says, Ali, I came in earlier and your colleague just told me to continue taking ibuprofen, so I did. He goes, well, you should have come in earlier. But anyway, in any case, like, he did all the checks and he said, like, looks like something could be wrong with your thyroid, but I'm not sure. Okay, so I'm going to send you for some blood tests. And he just sent me straight away to like the nearest hospital to get some blood tests. He rang me up and left a voicemail on my mobile to explain the results and what he was going to do next. And again, so it did change my opinion of him. It's just, I think he was a good doctor, but he just doesn't, have the niceties of like, oh, how are you? It's a nice day. He just kind of cut straight to the chase. But yeah, I mean, he was efficient and he checked up, but he doesn't use the flowery language.
So let's say it's just basic communication skill that people should be better at, doctors, so they could actually just give
Friendly
patients some ease.
smile. Treat them like
Yeah,
humans,
don't be grumpy.
not symptoms.
I would say even, grumpiness is not that big of an issue if it's humanized. If you can say, okay, it's not my best day, but you can still give the patients what they deserve. Sometimes very small things can make a difference.
That didn't sound good. You're grumpy. You give people what they deserve.
That's a fair point.
But it just goes a long way, doesn't it? Just like saying hello and asking how people are and like how you can help. I think it just makes a huge difference. I feel that, that patients are more likely to open up if they feel comfortable, especially if they've walked in nervous and in pain.
And you can do it in your way. I think that's quite important from a cultural difference.
In your own way.
point of
I mean,
view.
like I say, like this doctor did it in his own way.
Yeah, because from Croatian doctors, I wouldn't expect the level of nicety as I would from a UK doctor, for instance, because it's a different approach. But when you're not asked questions and you're not listened to, like this lady in labor, like a lot of women and a lot of minorities, then this will have negative outcomes, not just your confidence, but your health.
Definitely, because it's going to make them more reluctant to seek help when they need it. And I think we talked about this briefly when we were deciding on the topic about people seeking help and health advice elsewhere, and they may not necessarily be particularly reputable.
Exactly.
Yeah, Katerina has a comment. Okay, I'll read it. Katerina said, I do ask the pharmacist about the frequency or the way I should take a prescribed medication, and they're usually more generous with information than some doctors, except for my usual GP doctor. She's amazing, so I would stay with her for sure. Yeah. What do you say about that, Reena? Are pharmacists more welcoming in their messaging than doctors?
I think it really does. I think it really does depend. I mean, like the GP I have at the moment is great. Like she explains things incredibly well, and knowing that English isn't my first language as well, and she might draw a diagram or some sort of graphic to show when the medication needs to be taken. But I do
where it needs to
really
melt.
Important that the pharmacist talks about this if they haven't been given clear instructions by their doctor, because the way the medication is taken, depending on the medication, affects how much is absorbed. and the side effects that you get as well. So, for example, taking metronidazole, which is an antibiotic, for example, is usually taken 3 times a day. It has to be taken regularly because like these drugs have a half-life. It's best to be taken with or after food so that it's less likely to give you stomach upset. And you should avoid alcohol while taking it because then that can give you some side effects as well. And also it's important to complete the full course because for some patients it may seem logical, and in most cases you stop taking the medication once your symptoms have disappeared. But with the course of antibiotics, it's important to complete the full course because your symptoms may have disappeared, but there may still be some, guilty culprits, some bacteria lurking around, which if not killed off, could become like resistant in the future to other antibiotics. So it's important to complete, the full course.
Yeah.
So I think it just needs to be explained. I think if people are given the explanation or given the opportunity to ask questions, I think they're more likely to complete the medication they're supposed to be taking if they understand, why they need to take it, what it's for, and, be able to ask questions about possible side effects and the consequences of taking or not taking it.
Yeah,
Great question.
and what I like in the pharmacy, always when I get some medication, they write it down on the box how many times do I need to take it during the day, and what are the intervals and everything, and they explain it. I don't know if it's a custom everywhere in the world, but here in Croatia they do that, and I really like that part because you get some prescription. Okay, now do I need to read it? How should I take that medication? And this really helps then. Even without asking, they just write it down and say how I need to take it.
Yeah.
It's the
I mean,
small
it's just,
things.
sorry. Yeah, it's those small things. I totally agree. And it's what we did in the pharmacy as well, because we couldn't always assume that the doctor had time to do that because their consultation times are fairly limited. And also, even if they have been told, I think it's just like a further check just to make sure they understand what to do. But also, there are some differences between the way medication's given out in, say, like Spain and in the UK. So in the UK, we print out the directions on the label and we attach them to the box, whereas in Spain, I don't know if it applies to the whole of Spain, but certainly in the Basque Country, we don't have a printed prescription, or they're not sent electronically by the doctors to the pharmacy as they are in the UK. We're given a card, and the details are placed on a card, and then you take that to any pharmacy, and then they read the details that are on the card and issue the medication. But they don't print a label with the directions. But usually the doctor will have explained how to take it. But I do think it's helpful for the patient to maybe, have something that's visual
Yeah.
as well as spoken, because
Yeah.
that
Also, when you write it on the box, basically you need to take it, and you might have forgotten where the paper is, or you might have forgotten what explained it to you. How? Okay, do I need to take it once a day, twice a day? And on the box, it's written very simple.
And exactly, and it's even more complicated for patients who have complex conditions. So, for example, many elderly people might take a multitude of like different medications, and then they all have to be taken at different frequencies, at different times of the day, with or after food, and they're all for different conditions. So, I don't know. I also think it gives patients some ownership over their their health needs if they have that knowledge, if they know what their medication's for and why they're taking it.
For sure. I think at the end of the all of our examples and what we've talked about, Tanya, by the way, is thanking that we responded to her comments, and she says that this is the first time she's commented this much. So it's an emotional topic for her. Healthcare is emotional. It's something that we can't forget, the whole person and their fears and anxieties for their life. So I think a lot of healthcare professionals need to be reminded from time to time that they're dealing with people first. There's a comment from Mary that Darko will read to us graciously.
Of course. Mary says, I think it's one thing when it's a matter of character, another when it's a delicate time for the patient and the doctor doesn't show any compassion, empathy, or consideration. It's obvious that they see tens of people every day, perhaps sometimes hundreds, with the same situation, but some things shouldn't be just one of many. No need to apologize for long
No
comment.
need to apologise. I think it's an extremely important point, because often when, patients approach us, it could be something that they've had to pluck up a lot of courage to come in and seek help in the first place. It could be something that's, potentially embarrassing. If I think even in the pharmacy, I've had maybe like a young teenage girl, or even like older women come in seeking the morning after pill or like emergency contraception, and they're usually quite embarrassed about it. So one thing that we have to do is break down that shame that they might be feeling and normalize it, and maybe take them to a private area such as a consultation room, so they don't feel uncomfortable in front of other patients, and then reassure them that they've done the right thing in seeking help and it's nothing to be ashamed of, and that we're used to having these conversations. It's life. And then I suppose it helps them open up and talk about what happens. And I think, this is something that we do need to focus on, showing empathy and compassion, in these situations where, our patients do feel uncomfortable and need help opening up. They need to feel as though we're not going to judge them.
Yeah. And when it's not a matter of character, when your rights have been disregarded, then you have some legal rights then to deal with that. But if you are open to learning and communicating better with your patients, then Reena is your person. I know that you're developing a course. So for the end, could you tell us a bit about it and where people can find you? Because unfortunately, we need to wrap this up. This is one of our longest conversations. People are very interested about it, but we can't give you Reena for 3 hours, unfortunately, this
It's a
time.
hot topic, so yeah.
It is. I mean, it's a hot topic, and I've loved reading your different comments and questions as well. I think it's something that we can all relate to in some respect, because I think we've all been there. So anyway, my course is currently in development, and it's a program for pharmacists and people who work in the pharmaceutical industry, focusing on communication skills, particularly clinical communication skills. These pharmacists have busy lifestyles. They've probably already completed first certificate or advanced certification when they were younger, but they're a little bit uncomfortable when it comes to having conversations like with tourists or perhaps like recent immigrants who don't speak their language well. So the course works on developing their speaking skills in this context. And to do this, there'll be a program like a short bite-sized videos that they can watch online in their own time, and then weekly live role play sessions. So the language is focused on the typical interactions that they will have in their setting, as well as a community, because I like the idea of community, something that's worked well. In fact, some of the people following this talk and making comments are people who I've met in Rachel's course as well. So we're still kept in touch. There's something powerful, I'd say, about having a community to motivate you and keep you accountable and to learn and grow with.
You're referring to Rachel Roberts.
Rachel Roberts, yeah, of course.
And people can contact you on LinkedIn, right? If they
People
want
can
to
contact me on LinkedIn. There is a website that I'm working on at the moment with the lovely Renata Kucharska. So that's in development. So that will be launching soon. And I'm also working on a new Instagram page.
Okay, we'll be looking forward to that. And for our watchers and listeners, we'll update that info as soon as it's available. But in the meantime, please contact Reena on LinkedIn. Take care, everyone. Thank you for staying with us for 15 minutes over time. It's been really a pleasure to have you, Reena. This is a very important topic, and hopefully we can all have better healthcare professionals around us because of your work.
Okay.
Thank you.
Thank you, everyone, for
This is
listening.
really great.